Hey everybody, this is Dr. Daniel Choi here at North Texas Dental Surgery.
I'm Dr. Tyson Koo.
I'm Dr. Ioanna Koukousaki.
All right, so we want to show you a special case that a patient sent us from Florida. This patient had spent over $20,000 for an all-on-four, and he was wondering why he was looking like this. And this is the view from the other side. Yeah, so obviously looking at this, he has no back teeth, right? So anybody that invests a lot of money is probably not going to be too happy about that, right?
Yeah.
So,
And the implants were probably placed anteriorly due to the big sinuses.
right. So typically, even before we looked at the x-rays, we knew that was a big possibility. So let's look at his x-rays that he sent me. All right, so I know you guys have no idea what you're looking at, but this is actually a slice of a CBCT, the 3D scan. You could see he's got 4 implants here, and he's got very large sinuses, right? So we explained this in other videos, and I would highly recommend that we're going to link above a video that we did about like a month or 2 months ago, talking about some all-on-4 basics, but we know that, we all basically agree. Anybody that does all-on-4 will agree that whenever you do all-on-4, it's always the upper one that's going to be way more unpredictable, right? So if you come in and you're a patient right off the street, you give us a call and say, hey, I want to do all-on-4. The complexity of an all-on-4 case is always going to be the upper jaw. And Dr. K, could you explain, we just talked about this, what are the biggest reasons as to why upper all-on-4 is complicated, can be complicated?
Yeah. First of all, the bone is much softer than the lower jaw, and also the sinuses can get pretty big. And over time, when the patient is like an older age, but also we can see that in like younger patients as well. But that's going to be very, very challenging for the surgeon because he needs to find bone to place the implants and get the stability that you need so that we can actually put the teeth and get them supported by these implants. Otherwise, the patient cannot eat, cannot speak, and he's going to have a huge gap when he smiles like this guy. That's going to affect his everyday life.
So basically, when we're talking about this video, this case, for example, why he only has teeth from like canine to canine is, again, if he's going to have teeth back there, and we discussed this in our last video, which is again why we highly recommend you watch that. If you don't have implants supporting your back teeth, you don't want to extend your teeth all the way back there if your last implant is here, because that's going to create something called a cantilever, meaning that whenever something is supported further back from even like legs of a table, if you put your legs too close towards the center of a table and you start like pushing on the ends of it or jumping up and down on the ends of it, you're going to be loosening or causing damage to the hardware that's keeping the legs intact. So similarly, mechanically and physics speaking, you're going to cause issues with your dental implants if they are placed too far up front. Now, you mentioned sinuses. Sinuses, I know, before we all went to dental school, we talk about sinuses all the time. You see commercials talking about our sinuses. Our sinuses are basically just air-filled cavities in our upper jaw, right? So whenever we just have air-filled cavities in our upper jawbone, if I'm placing an implant, let's go back to this image here. If this is all air and I'm placing dental implants in here with just this much bone right here, then this implant's just going to fall out because there's not enough bony support. So, what he needs is to be able to have teeth back here and here. He needs to have a dental implant supporting it here or even further back here or back here to be able to support this whole prosthesis, right? And so, actually, I'll let you take over here, Dr. Koo, in regards to there's a lot of patients like we have like this, and we're going to actually show you 3 examples here coming up for patients that we've seen here recently that have this issue, that just have large sinuses. So, can they get all-on-4 dental implants? So what is the solution for that?
For sure. So, Dr. Choi briefly went over the concept of a cantilever. In a situation like this, if we want to minimize a cantilever, there are several options. One option could be doing what's called a sinus lift first, so that we can add some bone height to the posterior regions, wait for several months, or sometimes we can place implants at the same time. And that way we can place some implants in the back and have some more support in the back.
Now, if I can interject, the sinus lift is going to be the oldest of techniques to use.
Yeah.
And it's like if you were to even do single implants, if you wanted a back molar implant and you have low sinuses, it's a procedure that we do quite often to be able to give you the bone to be able to place that implant. But here's the catch. When we do all-on-4, people want solutions like right now, right? They want teeth like that same day that are screwed in. They don't want to wear denture like overdenture patients do. That's why all-on-4 is like a big draw. So let's talk about the two options, because in a case like this, we can sinus lift them, right? We can do some, and I love to use something called bovine bone. It has great density whenever we do sinus lifts, and we let that heal for 6 months and we place the implant. However, keyword being 6 months, right? A lot of people want immediate solutions. So let's talk about the immediate solutions, Doctor.
Sure. The other commonly used option would be placing implants in a different bone. We can place implants through the zygomatic bone, essentially the cheekbone, or you can also place implants in what's called the pterygoid, which you can't really see.
Right. So the pterygoid plate is a bone back there off the sphenoid. I know, not to go into all the details, but there's an implant basically that you can place back there where you have very dense bone. Now, we're actually going to make another bone talking about zygos and pterygoids, because it's actually a very complex and long drawn out video. So we're not going to talk about all the logistics with those implants in this video. But long story short, those are two options that we can do. Right. So whenever we see a case like that, when we treatment plan, somebody comes like that, we see them for a consultation, we look at the sinuses, we're like, okay, all right, you got huge sinuses. We got several options, right? So you can either do zygomatic implants, we could do pterygoid implants, we could do a sinus lift, but you're going to need one of those options back there to be able to, give you teeth back there. Now, when we see a case like this, now, just to give you a little background information of the story, like this patient, again, he contacted us this past summer. He had this procedure done for all-on-4, and when he woke up and he came out of surgery, he only had teeth from here to here. So he sought another consultation. They took CBCT on him, the 3D scan. They let him know basically, hey, this is what's going on. They also, attempted to do pterygoid implants on him. And he's like, that's what it is right now. We might have to do zygomatic implants on you, or, sinus lifts, all that stuff. So that's what they told him. So he found us online, and then he wanted the consultation with us. And so I spoke to him and I told him, hey, basically I agree with exactly what that other doctor was saying. You have very large sinuses. You would have to resort to sinus lifting, which he had, who knows about the prognosis on that, because he has very, very little native bone. If they already did the pterygoids, let's hope that they did the pterygoids properly, so the bone it's actually going to engage and not fail. But basically, we had to tell him to be in a sit and wait, and he had to kind of see what it was going to heal like. Now, is that the case that we see for a lot of these cases, where we just tell patients that they're going to look like that? Well, no, right? So we tell them, and so my thought process, I'm going to ask you guys kind of what your thought process is. If we see a patient like that, what do we tell him about their options, right? So number one, what we could do is, I want to give you a small little example of a zygomatic implant, zygomatic implants and pterygoid implants we had on a patient who visited us from North Dakota. This is her. She had very large sinuses. So what we did was we did some zygomatic implants on her, and also what we call pterygoid implants on her. And so we actually finished her up, and she had a great result. But that's something that we have to do for some patients who don't want to go through the sinus lifting process, or if they have great bone. And I don't want to sound morbid about it, but if they are more elderly in age, then this can be a very great solution where they can kind of bypass the sinus lift, right? So again, the sinus lift is a great procedure, but it's going to add another surgery and add another 6 months of time. What are your thoughts about cases like this? How do you tell patients in regards to zygomatic versus sinus lifting versus pterygoid implants? What are your thoughts in regards to kind of what patients should get for these procedures?
So I think both the sinus lifting first and doing implants, and then versus doing zygomatic and pterygoid. I think both both options are viable options. But if my parents were to get this type of treatment done, I would try maybe sinus lifting first and see if that works out. And if that fails later, then I want to try zygomatic implant route.
Okay, so I actually am very similar, like in my thought process. I've done so many sinus lifts in my career; they have great results. So if a patient I have is like 50 years and younger, I'm always going to try to go to sinus lifting, and I'll tell them to like just try to be patient, and I'll also hit pterygoids. And I'm going to show you examples of a case that we did where we exactly did that, and kind of like my thought process. But I wanted to focus on one thing real quick. Dentistry is very subjective,
Yes.
right? So everybody's kind of got like differing opinions. And so there's not one, like only one way to skin a cat. There's like many different options on how we can do this. What are your thoughts on this, Dr. Koukousaki?
I would say from surgery standpoint, I would prefer bone grafting as well if the patient has the time, the money, and can actually be in a good stage on like oral hygiene and like be able to like follow the instructions that the surgeon is going to give him. And the reason is that as the patients get older, once they go for zygoma, then it's very, very difficult and almost like impossible to come back to bone graft. So it's better to go ahead and like plan that bone grafting procedure if they have the time and the money, of course. And then if something fails, if something happens, then they can proceed for the final resolution to the solution to this problem, which is going to be zygoma.
Okay. So we want to stress that basically we actually mentioned this in the roundtable discussion. We'll release that video in the future, but all on four is a great solution. What you got to understand though is that we do lots of these and we see all the pros and cons of it, right? So just like, although it is a great solution, there's a lot of eggs like that are being thrown into one basket. So as great as it is, like a lot of things also need to go right, right? If one little thing can like goes wrong, it can literally throw everything off, right? And we all agree with that. And understanding, like you brought up a very key point. I believe you agree the same thing as like zygomatic implants, zygomas need to be saved as a like a last ditch. Yeah. If you are elderly, then it is a great option to bypass and save another surgical procedure. If you're younger, then I can tell you that if in my like everything I know about all on four, and if you're dealing in my mouth, I would actually versus heading straight to a zygoma, I would tell you, hey, you're doing a sinus lift and implant on me and pterygoids. If I had sinuses that look like this, that's what I would say. Now his sinuses were very large, so he might have to go straight to a zygo. But we're going to show you like other examples where I actually did combinations of like pterygoids and sinus lifts, and I was able to avoid zygos because these patients were younger. So we wanted to touch upon the like zygomas, and like we mentioned, well, why would you want to try to save it as a last ditch? So your cheekbone is and not on every single patient. Some people have very thick cheekbones, some people don't. So some people are better candidates for this. But the cheekbone is a great option to resort to in the event that you have implant failure, right? What people need to understand is that when you're doing all on four, and you have an implant failure, especially your back ones, which are right in front of your sinuses, we want to avoid a huge like cantilever. So if an implant fails, we don't stick a new implant exactly in that same site. We try to move it out of that infected area. So sometimes we don't have the resort. Maybe you have too little bone remaining or you have infected bone. Long story short, surgically, we kind of have our hands tied behind our back whenever we're trying to do like, what we call revision surgeries, where we're trying to fix your all on four. So a lot of times we have to head to what we call these zygomatic implants. So you want to save those for, in times like this, right? But the problem is that there's some downsides to it, right? If there were no downsides, we're gonna head straight to this, right? Well, one of the downsides that could happen is like if you could also lose zygomatic implants,
Correct.
right? Another issue is even if you a zygomatic implant is done right, you could potentially have sinus issues, right? That's a common complication. Not saying that you're gonna have sinus complications. Knock on wood, I haven't had a patient that has had these issues. Other more rare issues are like subcutaneous infections that can be aesthetically like a nightmare. So little nuances like this, but there are little like nuances that could happen, which are reasons why we're going to try to avoid them in the first place because of their more complex nature due to complications. Would you guys agree with that?
For sure.
Yes.
Yeah. Okay. So that's why, again, why we would try to. Now, I actually use like pterygoids as kind of like a mainstay. Um, but again, we'll create another video talking about the pros and cons of zygomatic implants and like pterygoids. But pterygoids are great implants, but they are further back there, so they can be a little bit more complicated, whether in regards to placement, restoring them, actually getting the screws in there just makes your life more difficult, right? You know, so there's like little nuance, and even some patients complain about pterygoids, right? Because it
Yeah.
extends further back, so it's a little annoying. Like I find out that most people don't seem to really care, but some people are like
Some people has like a gag reflex.
right, right,
That's true.
yes, because it extends back further.
Yeah.
Do you have any thoughts?
About the zygoma, I would say that we cannot like think that once the zygoma fails, we can put easily another one because every patient has a different anatomy. Like their skulls is different, and their cheekbone sometimes is super thin, and it doesn't give us the option to go in again and find another spot that's gonna have that thickness of bone that we need. So sometimes we like try to get advantage of that bone, but once we do it once, then we don't get the chance to place another one. So depends on the face, depends on the anatomy. Like it can get very, very tricky in case we lose that zygoma.
Totally agree. Our life becomes way more stressful trying to find native bone which isn't infected. I've never even looked at my cheekbones, but like we have Asian faces, you know. So like the Korean guy we just did his all-on-4 surgery on that he had huge sinus. So we're gonna actually show you his case. He didn't have good zygos, right? So your facial structure, high cheekbones, low cheekbones, like all these little things can play a role in regards to like whether you're a really great candidate for zygos. And you know, but we find that like a lot of patients at least have some bone to like do zygos. But again, God forbid you lost those and we had to place new ones. So that's one of the things that we had a patient who was like 50 years, maybe like not even 50, but he was told that he had severe periodontal disease. We did pterygoids and implants on him. He had a great result, but they were telling him to do zygos and like he had all his teeth. I was like, no, why are they telling you that, right? And Dr. Koo, we were talking about that as like we both agree that there's a lot of patients, a lot of doctors that seem to love placing zygos on patients,
Yeah.
right? And it was almost like they love like posting them on Instagram. It's like I don't know what it is, but it's like a point of pride, like to show you like zygos and as many all-on-4s as we do, we still try to avoid doing them, right? We almost did one on a patient like a week ago. There's another patient in about like 3 weeks that he needs, you know, zygos. But again, we do quite a bit of cases and we do like we manage a way to stay away from them. But before we show you these other cases, do you guys have any questions or thoughts about regards to anything that you want to add on about this conversation?
Yeah, so I think it's always good to have some contingency plans because, yeah, we certainly place implants, you know, hoping that things will last a very long time, sometimes a lifetime, but we cannot, you know, confidently promise you that things will last your lifetime. You know, even when things are done perfectly by like the most skilled surgeon and, you know, stars align, sometimes things may fail at some point. So I think it's good to have contingency plans before we commit you to like a certain type of treatment plan.
So basically, that's a perfect lead into you know, with my the X-rays and whatever that we're going to show you with our recent cases, because we are not like doing our job if we make the assumption that everything is going to work perfectly 100% of the time. We literally place your implants in a way and do some other things to be prepared that in the event that one of your implants fail, we have contingencies, right? So let's actually just jump right into it. All right, so basically, this is a patient that came in about 2 months ago. She has obviously a lot of broken down teeth. She's missing a lot of teeth, and she's got a collapsed bite. But let's look at her case, her X-rays. Okay, so obviously we see like the missing teeth, the broken down teeth. She's got some root canals that are getting infected also. See similar situation. Now, we were just talking about this, obviously, large sinuses. She definitely has some large sinuses. And the issue is that when we take we're looking at her photos, she's extremely gummy also, meaning that we could see her gums. And so what we're trying to do is we're trying to avoid showing her transition line. All right, I want to use this as an example. This patient has what we call a high smile line. We could see her gums, and this is what it looked like after that she did her all-on-4. So this is what it looked like afterwards. Like, so when she smiles, you were able to see her transition line where her fake gums meet her original gums. So this is an example of what we're trying to avoid on a patient that has a high smile line. So this is exactly what we're talking about with the high smile line. So one of the things that's very important is if I'm going to make your job easier, Dr. Koukousaki, is I got to make sure I reduce that bone. And I know every day it stresses you out, right? Seriously. So it's very important that we have to reduce that bone. But Dr. Koo, we know that when we do that bone reduction, that's like when we take out that bone, when you have a patient that already has huge sinuses, we don't have that much bone to engage.
Correct.
Right? It becomes very challenging for us.
Yeah.
Yeah, long story short, it makes our surgery a lot more stressful, right? And let's take a look at what we did for her. So again, this is how she presented originally, and this is what we ended up doing for her. So we did 4 implants with some pterygoids and 5 implants down low. But as you see, we were able to secure the implants. Now, these are something called a trans-sinus. So I was going through some of the sinus a little bit, but got great support. I didn't even need to do pterygoids on her, honestly. We had only a 1-tooth cantilever, but I did anyways. But we were able to get a nice and steady, like a strong supports for her teeth so that we could avoid cantilevers, right? So even though she has large sinuses, we were able to engage different types of techniques without doing sinus lift, just because we've done so many of these that were allowing us, this patient, to be able to avoid having her teeth, like making it look like when she smiled that she didn't have some teeth there, or that she wouldn't be able to chew properly. So let's actually show you her photos. Okay, so this is what it looks like afterwards. So she is in her temporaries. We did this a few months ago, so we just need to wait a few more months before we fine-tune her prosthesis and get her into zirconia. Let's show you another example that's more drastic. So, okay, so this is a patient, 37 years old. She has a bunch of root canal issues, crowns that are failing, so she wanted all-on-4. Some things we see right off the bat is she has a very high smile line, right? But the thing that was actually complicating about her surgery was actually what we see when we look at her 3D scan and pano. All right, so this is what we had, right? So a lot of root canal infections. Dr. Koo, what do you see on this?
Humongous sinuses.
Right. Yeah, so honestly, when I looked at this 3D scan, I mean, this is where we tell patients, I mean, not every all-on-4 case is built similarly, right? I mean, there's, no matter how many we do, they're like, from a surgical perspective for us, I mean, there's some cases that just stress the heck out of us. And, this patient was visiting us from Virginia, and she has a high smile line. So we need to hide her transition line. I mean, you cannot take someone who's pretty and, like, have her afraid to smile anymore because you're going to see that transition line, right? That would be an utter catastrophe. That would be considered a failure for us. Right? And then also making sure that we place those implants where they need to be and avoiding cantilevers when she has very large sinuses, right? Again, the sinuses are just air-filled cavities. So this case is actually a pretty complicated one. So again, these are very large sinuses, right? And you could see the delineation of like where these sinuses are. And again, these are just big air-filled cavities. I'm trying to get, excuse me, trying to avoid a cantilever and place these implants, as far back as I can, because I got to get at least to her first molar to be able to get teeth back here. So if this is going to be where her last tooth is, I need to get an implant right around here, but look at this huge sinus. Plus, I had to reduce bone, so I have very little bone that I'm going to place this implant in. So, what we did was we did something called trans-sinus implants again, and I also, we were just discussing this in regards to having contingencies. She's 37 years old, right? So to be taking out her teeth and doing all on four to avoid this vicious circle of failing, crowns and root canals, and she's investing in something going with all on four. How are we going to do something that's going to give her a great long-term prognosis? Well, we're going to do that with giving her more implants than four, avoiding excessive cantilevers, so we're avoiding a lot of stress on each individual implant. And I also sinus lifted her and put extra implants in there because I want her to have contingencies. And then, again, like we said, some people might have just looked at her and said, hey, let's go straight to a zygo. But, she's only 37 years old.
Yeah.
If you had to promise your life on it, would you have put zygos on her?
No, I would tell her to maybe wait for at least 20, 30 years.
And just wait off as long as possible. What are your
Yeah.
thoughts, Dr. K?
Yeah, same. She needs to have these back teeth because she has a full smile, a very, very high smile line. That means that she has a gummy smile right now. And she shows a lot of teeth in the back. If she goes right away for the immediate solution of just getting zygomas, actually she's not like in such an urgency. She can keep her teeth. She can like go ahead and do some sinus lifts in the back, put some bone graft, and then wait and get the implants over there instead of like going straight to the final solution, which is going to be zygomas.
Right. So we mentioned in this video, we also mentioned zygomas and pterygoids. So that's actually, I did implement the pterygoid strategy though, right? Because I wanted back support. So let's look at what her x-rays looked at after the surgery. So here's what we did. We got these 4 implants. We got great stability, trans-sinus on those. We did pterygoids, and we also did, again, sinus lifts on both sides. I put an implant here because I had enough bone to stabilize here. I didn't have enough bone to be able to place an implant here, but at least I'm going to have plenty of bone now to be able to place that implant in the future. So she'll have 8 implants, right? So again, this is what she looked like before. This is what she looked like after. Some people might be wondering why I placed, this implant further out here as well, because she has her mental nerve positioning, she was going to have an excessive cantilever if I placed a traditional all-on-4 configuration. So that's just a small example. So let's look what she looked like afterwards. Okay, so this is what she looks like afterwards. So we were able to, do the occlusal bone reduction, and also be able to support, with implants so that she could get her back teeth, and so she wasn't going to look like, that other patient we started off the video with where we saw only canine to canine, which for her being a 37-year-old attractive female would have been a catastrophe, right? So Dr. Koukousaki, you did a great job restoring this case. Patient was very happy. She's a little swollen in this because this was actually a photo from the next day. But do you have any other thoughts, Dr. K?
No, I think that the plan of like getting more implants to support the teeth is not only going to prevent any breakage of like the temporary teeth, but also the final zirconia is going to be fully supported. And later on, if she needs to get another implant from the other side, the surgeon's going to have the bone to support it.
All right, thanks. Dr. Koo, what are your thoughts on this case?
Yeah, so in this case, Dr. Choi and Dr. Koukousaki were able to successfully hide a transition line, which is the area where the prosthetic teeth and the gum tissue meet. We'll be soon posting our vlogs. We started vlogging, and in one of the videos, we're going to demonstrate how we plan the case to make sure that we do the bone reduction appropriately.
Okay, yeah, so this case actually stressed me out, right? Like, Dr. Koukousaki, you restored the case and you did a great job, but Dr. Koo, you were also with me in the surgery, right? Remember when I was placing that trans-sinus on the left side and you couldn't hear that fracture?
Yeah.
So, but I mean, we still got enough stability and we augmented the bone like crazy. We also did a little kind of what we call guided bone regeneration. So a lot of times patients also ask it, it's like, hey, you never have to do bone grafting? It's like, we still have to do bone grafting in cases where we need to add the bone to make sure that the patient has the best long-term support. So let's talk about one more case here. Okay, so this is a case that we actually did today. This patient has severe periodontal disease. He's missing some teeth, but the killer about this procedure is twofold. He has an insanely high smile line. So that's a consideration, right? I need to hide the smile line, so I need to do some bone reduction. And then the other thing is his large sinuses. Okay, so here we go. Again, similarly, just very large sinuses, and the problem is that they drift like very far, what we call anterior. So whenever I'm placing my dental implants after I do all this bone reduction, I don't have that much space to be able to place his implants. So similarly with the other cases, what we did is we did how many implants did I do on him? I did like 6 on him today.
Yeah.
Yeah, 6 with bilateral sinus lifts. With him only being 40 years old, I mean, this guy's 5 years younger than me, right? So I'm only, again, going to do on patients what I would do within my own mouth. So I know this is like, he was a little bit sedated, so this is a horrible x-ray. We nailed some pterygoids, we got great stability, and we did 4 other implants in front of his sinuses. I also did bilateral sinus lifts, so I'm going to place 2 more implants on him in the future. And so thought process on this. So let's look at his photos afterwards. All right, here we go. So Dr. Koukousaki did a great job restoring this case. Yeah, everything looks great. And again, these are just his temps, so we'll change those down in the future after we place those 2 other implants. But again, this is where, and again, the biggest thing was we were able to hide his transition line, right? I think the biggest thing about this is that, again, dentistry is very subjective, and everyone's going to potentially do things differently, right? I know this would be kind of an inflammatory comment, but if here at North Texas Dental Surgery, we're, family owned, and, we warranty our products, and, and it's not even that. I'm going to tell people too that we're going to do what we would do in our mouth in other patients' mouths. So again, this guy's 5 years younger than me. He's Korean American, just like me. What am I going to do? Like, I'm just going to do on him what I'm going to do in my mouth, and that's exactly how I treatment plan this case. But would it be like kind of like I mean, I like when I'm seeing more and more corporate dentistry, right? So it's just kind of like wham bam, thank you, ma'am. Like, and it's just like, here, we're going to give you a solution. We're going to do one surgery. Could you potentially see a situation where we say, okay, this guy's 40 years old, but we're just going to do zygos on him, and like zygos and pterygoids, and then like just be done with the surgery, not sinus lift him? You could easily see that happening, right?
So yeah, I already see it happening.
Right.
Yeah.
You see it happening, right?
Yeah.
And I was telling you about that case that I had. The guy was from Chicago, and he was told to do zygos, and I was like, I think it was absolutely crazy that they're telling him to do zygos at this point. Like that option needs to be conserved for like later in the future. But typically what happens with all on fours is it's a package deal. Like, you're paying for all this one deal. So if we have revision surgeries we got to do, or another surgery where we place additional implants, we're not being compensated for that. So there is a tendency where I could say that more and more patients are going to get a protocol recommended to them to just be done, right? Where I think the best protocol is a case-by-case basis where people should have all their options presented to them.
Yeah.
Do you have any thoughts, Dr. Koo?
A personalized treatment, having a plan A, plan B, plan C, and also going according to the patient's requirements and whatever they can do, like financially wise and time wise. But I think the best thing is to just make sure we can give the patients all the treatment options, the possible treatment options.
That's informed consent, right? So we have to tell the pros and cons of each solution, right? And if all the options never have any drawbacks to them, then we can equally recommend them, right? So we have to recommend to the patient. Now, we will also give us our strong recommendations in regards to like, okay, here are the options, but then here's what we think in the end. I would say, hey, let's keep that zygo in the back pocket, right? You're only 40 years old. The other patient before was only 37 years old. Let's keep that zygo in your back pocket. We can easily sinus lift today, build up that bone, and place an implant in the future. And just, again, just with everything that we see, because what's very important for us to get the patient to understand is that not every all-on-4 is easy, right? Or is just as like they're all problem-free. There are certain cases that are a lot harder than others that can be rife with complications in the future, and to the point where patients can have a lot of regrets, right? So it's very important with what we see. We want to have that patient obviously have an ideal outcome, a perfect outcome, a great outcome, but it's very like we want to let the patient know about all the things that can go wrong. We also want them to know about the contingencies that need to exist for us to be prepared that in the event something does go wrong, what are our other options that we have, right? Was there any other thing else that you guys have any other thoughts?
Yeah. So here at North Texas Dental Surgery, we definitely do a lot of all-on-4 treatment, but we do not recommend that to every patient that we see. For instance, if we see a patient that has a lot of their teeth still intact, and if we determine that the patient may be better off with what's called a full mouth rehabilitation on their natural teeth, then we can certainly offer that option.
Right. So it's not a cookie cutter approach. We diagnose everybody on a case by case basis, present your options, and then you decide which one you want to go with. Any other thoughts, Dr. K?
I think you mentioned all the good points. I would just say that every patient is different, and their anatomy is different, their bone is different, their aesthetics are different. So getting a personalized treatment from a private practice that has a lot of different specialties inside and many different options and opinions that the patient can actually hear from all the dentists is the best solution, so that the patient can have like a better idea of what's going on and what's going to be the plan for him.
That's actually very great advice. Thank you for your guys' time. Hopefully you guys found this information helpful. If you have any other questions, please feel free to leave a comment in the comments below. Thank you.